Hi everyone, this is Sindhu, a medical student. For the next few minutes, consider me as a well-wisher because I will be talking about some important information related to your heart. And the burden of cardiovascular diseases in our society is very high. And especially today being the World Heart Day, maybe it's time we start making some changes and decisions and choices consciously towards the health of our heart. Burden of cardiovascular diseases on our society is very high. Very common one that everybody hears of is hypertension. It is generally addressed as BP or said as having blood pressure in general terms. A person is said to have hypertension when the person has a blood pressure elevated over 130 by 80 mm of Hg constantly. It is important to note here that you just should not call anybody hypertensive or just do not diagnose for yourself that you have hypertension just based upon one single reading. You should always consult a certified practitioner in order to call someone hypertensive or decide for yourself that you have hypertension. Now, let me ask a simple question to help you understand the amount of burden that the hypertension have in the society. How many of us have not heard that someone we know or someone even close to us are diagnosed with hypertension? Maybe not, because every single one of us have sometime at some point heard that somebody has hypertension. It is not very surprising because all over the world 1.3 billion people actually suffer from hypertension, and even more surprisingly only 1 out of every 5 those who are diagnosed actually have it under control. Well, this springs out of a common misconception that hypertension is just a disease or it usually occurs in old age. Well, it is very important for you to note that it is not just a disease or usually occurring in old age, because this is not to scare you, but this is a fact that there are more women who die of hypertension in America than of cancer. But we don't have the same attitude that we have for cancer towards hypertension. Before I start talking about lifestyle changes, let me state some of the factors that actually cause the hypertension. The very important and the first ones are the smoking, alcohol and tobacco. Basically, these are the very important factors, and other factors that also play a major role are obesity, overweight and high salt diet or no exercise. In some conditions, even when the person does not fall in any of these categories, they can still be hypertensive. Well, this is attributed to the genes, or to put it in simple terms, hypertension runs in families. Well, there is a famous quote which I would like to mention here: genes only load the gun, but lifestyle pulls the trigger. This is very true for hypertension. So what are the lifestyle changes that we have to make? It's basically doing the opposite of all the factors that cause hypertension. It is basically quitting smoking, and alcohol is very important. There is a limit for salt intake for everybody. Generally it is 2.3 grams per day, but in adults also involves the salt that you consume through packed foods or freeze-dried foods or soups or any fats, especially the saturated and trans fats. The next one is exercise. pain, but these are only symptoms that are found rarely or might also be related to other conditions. So if you have any of these symptoms, do not consider you have hypertension. Like I said, consult your physician and get a confirmation, especially when it's related to your heart, just because someone told you so. So every time you make a choice to eat healthy or to exercise or to meditate, you are basically doing yourself a favor, your heart a favor, for the better health. So let's start taking some crucial and healthy steps towards the betterment of our heart and the rhythm that keeps us alive.